situation is not easy. Thank you for the support that you've given to our healthcare workers who are risking their lives to keep us all well. Thank you for doing your share by always wearing masks and respecting our safety protocols. Thank you for keeping your distance today for a better tomorrow. And as we recover from this pandemic together, please know that St. Luke's Medical Center will always be open and committed to safely provide the healthcare you need. It's safe at St. Luke's.
Hindi ka na kumain. Hindi ka kumain, no? Mother me.
Sorry, look. Ang dami kwento. Kasi kanina.
Is St. Luke's Medical Center safe? The answer will always be yes. It has always been that for the last 117 years. As long as you need the safest care, as long as you need quality health care, as long as your family needs the best care, St. Luke's Medical Center remains open, safe, and committed. Every single person working at St. Luke's is committed to keep you safe. Always. There are important questions you need to answer before undergoing surgery. Will you be treated by highly skilled surgeons? Will they be performing your surgery in a safe environment? Will you be provided with quality patient care? The answer will all be yes at St. Luke's Medical Center. Choosing a hospital could be the most important decision you'll make. Choose St. Luke's.
A fresh journey awaits you at St. Luke's Medical Center as we redefine patient experience to give you more comfort, convenience, and choices you deserve. Waiting lounges are made cozier and more comfy. We have enhanced our patient room amenities, providing new bed essentials, toiletries, special room features, a complimentary in-room coffee and tea station, and minibar items. To give you quick access to St. Luke's concierge services, including the new and expanded St. Luke's room service menu, a digital compendium is available for you and your companions inside the room. We want to be part of your blissful milestone, so mothers giving birth at St. Luke's will be served with a complimentary 3-course meal on the night prior to hospital discharge. While an exclusive I Am a St. Luke's Baby outfit will be given as a welcome gift to newborn. Needy patients also get
Ako running ka po and
It makes us appreciate the value of being together. It significantly changed the way we live. We know how much you miss kisses from your loved ones, getting hugs from your friends, handshake from acquaintances, and seeing the smiles of people you encounter every day. Our situation is not easy. Thank you for the support that you've given to our healthcare workers who are risking their lives to keep us all well. Thank you for doing your share by always wearing masks and respecting our safety protocols. Thank you for keeping your distance today for a better tomorrow. And as we recover from this pandemic together, please know that St. Luke's Medical Center will always be open and committed to safely provide the healthcare you need. It's safe at St. Luke's.
Our COVID-19 experience has opened our eyes to a lot of things. It makes us appreciate the value of being together. It significantly changed the way we live. We know how much you've missed kisses from your loved ones, getting hugs from your friends, handshake from acquaintances, and seeing the smiles of people you encounter every day. Our situation is not easy. Thank you for the support that you've given to our healthcare workers who are risking their lives to keep us all well. Thank you for doing your share by always wearing masks and respecting our safety protocols. Thank you for keeping your distance today for a better tomorrow. And as we recover from this pandemic together, please know that St. Luke's Medical Center will always be open and committed to safely provide the healthcare you need. It's safe at St. Luke's. Is St. Luke's Medical Center safe? The answer will always be yes. It has always been that for the last 117 years. As long as you need the safest care, as long as you need quality health care, as long as your family needs the best care, St. Luke's Medical Center remains open, safe, and committed. Every single person working at St. Luke's is committed to keep you safe. Always. There are important questions you need to answer before undergoing surgery. Will you be treated by highly skilled surgeons? Will they be performing your surgery in a safe environment? Will you be provided with quality patient care? The answer will all be yes at St. Luke's Medical Center. Choosing a hospital could be the most important decision you'll make. Choose St. Luke's.
A fresh journey awaits you at St. Luke's Medical Center as we redefine patient experience to give you more comfort, convenience, and choices you deserve. Waiting lounges are made cozier and more comfy. We have enhanced our patient room amenities, providing new bed essentials, toiletries, special room features, a complimentary in-room coffee and tea station, and minibar items. To give you quick access to St. Luke's concierge services, including the new and expanded St. Luke's room service menu, a digital compendium is available for you and your companions inside the room. We want to be part of your blissful milestone, so mothers giving birth at St. Luke's will be served with a complimentary 3-course meal on the night prior to hospital discharge. While an exclusive I Am a St. Luke's Baby outfit will be given as a welcome gift to newborns. Pediatric patients also get special treats. Signature breakfast meals will be served to encourage and delight our young patients. For added convenience, our patient care navigators are ready to welcome and assist you, from screening to completion of care to maximize your hospital visit. With express admission, waiting time for patients who are advised to stay in the hospital is lessened. Patients get admitted directly to their rooms. No pit stops, no long queues. St. Luke's in-room discharge system makes the patient discharge process quick and convenient. Our concierge staff will visit you in your room to facilitate and complete discharge inside the room. All these new service features are implemented following strict health protocols. It is our goal to give you a smooth and hassle-free hospital experience because your comfort, convenience, and choices matter most to us. It's the quality of service you would expect in a world-class hospital, only at St. Luke's.
St. Luke's Medical Center is recognized as Philippines' leading and most respected healthcare institution. We provide services for women of all ages for the proper care of their health needs. This includes gynecologic ultrasound. St. Luke's Women's Health Center offers gynecologic ultrasound. This service helps doctors assess not only the uterus but also organs inside the pelvis. This can be performed through transabdominal ultrasound or transvaginal or transrectal ultrasound. Pap smear for cervical cancer screening. Breast imaging. St. Luke's Breast Center also offers state-of-the-art breast imaging, from screening and diagnosis to treatment and counseling. For breast cancer screening, we offer digital 3D mammography and conventional 2D mammography. For women in high risk for breast cancer and dense breasts, screening can also be complemented with breast ultrasound. All images are interpreted by our highly trained breast radiologists. Bone densitometry can also be found at the St. Luke's Nuclear Medicine. This service helps doctors detect osteoporosis and assess for risk of fractures.
Way we live. We know how much you've missed kisses from your loved ones, getting hugs from your friends, handshake from acquaintances, and seeing the smiles of people you encounter every day. Our situation is not easy. Thank you for the support that you've given to our healthcare workers who are risking their lives to keep us all well. Thank you for doing your share by always wearing masks and respecting our safety protocols. Thank you for keeping your distance today for a better tomorrow. And as we recover from this pandemic together, Please know that St. Luke's Medical Center will always be open and committed to safely provide the healthcare you need. It's safe at St. Luke's.
Joanne Tan Garcia is co-host.
Is St. Luke's Medical Center safe? The answer will always be yes. It has always been that for the last 117 years. As long as you need the safest care, as long as you need quality health care, as long as your family needs the best care, St. Luke's Medical Center remains open, safe, and committed. Every single person working at St. Luke's is committed to keep you safe.
Na ano,
Always.
malinaw naman siguro. Hindi.
There are important questions you need to answer before undergoing surgery. Will you be treated by highly skilled surgeons? Will they be performing your surgery in a safe environment? Will you be provided with quality patient care? The answer will all be yes at St. Luke's Medical Center. Choosing a hospital could be the most important decision you'll make. Choose St.
A fresh journey awaits you at St. Luke's Medical Center as we redefine patient experience to give you more comfort, convenience, and choices you deserve. Waiting lounges are made cozier and more comfy. We have enhanced our patient room amenities, providing new bed essentials, toiletries, special room features, a complimentary in-room coffee and tea station, and minibar items. To give you quick access to St. Luke's concierge services, including the new and expanded St. Luke's room service menu, a digital compendium is available for you and your companions inside the room. We want to be part of, so mothers giving birth at St. Luke's will be served with a complimentary 3-course meal on the night prior to hospital discharge. While an exclusive I Am a St. Luke's baby outfit will be given as a welcome gift to newborns. Pediatric patients also get special breakfast meals will be served to encourage and delight our young patients. For added convenience, our patient care navigators are ready to welcome and assist you, from screening to completion of care to maximize your hospital visit. With express admission, waiting time for patients who are advised to stay in the hospital is lessened. Patients get admitted directly to their rooms. No pit stops, no long queues. Luke's in-room discharge system makes the patient discharge process quick and convenient. Our concierge staff will visit you in your room to facilitate inside the room. All these new service features are implemented following strict health protocols. It is our goal to give you a smooth and hassle-free hospital experience, because your comfort, convenience, and choices matter most to us. It's the quality of service you would expect in a world-class St. Luke's.
St. Luke's Medical Center is recognized as Philippines' leading and most respected healthcare institution. We provide services for women of all ages for the proper care of their health needs. This includes gynecologic ultrasound. St. Luke's Women's Health Center offers gynecologic ultrasound. This service helps doctors assess not only the uterus but also organs inside the pelvis. This can be performed through transabdominal ultrasound or transvaginal or transrectal ultrasound. Pap smear for cervical cancer screening. Breast imaging. St. Luke's Breast Center also offers state-of-the-art breast imaging, from screening and diagnosis to treatment and counseling. For breast cancer screening, we offer digital 3D mammography and conventional 2D mammography. For women in high risk for breast cancer and dense breasts, screening can also be complemented with breast ultrasound. All images are interpreted by our highly trained breast radiologists. Bone densitometry can also be found at the St. Luke's Nuclear Medicine. This service helps doctors detect osteoporosis and assess for risk of fractures.
COVID-19 experience has opened our eyes to a lot of things. It makes us appreciate the value of being together. It significantly changed the way we live. We know how much you've missed kisses from your loved ones, getting hugs from your friends, shake from acquaintances, and seeing the smiles of people you encounter every day. Our situation is not easy. Thank you for the support that you've given to our healthcare workers who are risking their lives to keep us all well. Thank you for doing your share of safety protocols. Thank you for keeping your distance today for a better tomorrow. And as we recover from this pandemic together, please know that St. Luke's Medical Center will always be open and committed to safely provide the healthcare you need. It's safe at St. Luke's. Is St. Luke's Medical Center safe? The answer will always be yes. It has always been that for the last 117. As long as you need the safest care, as long as you need quality healthcare, as long as your family needs the best care, St. Luke's Medical Center remains open, safe, and committed. Every single person working at St. Luke's is committed to keep you safe. Always. There are important questions you need to answer before undergoing surgery. Will you be treated by highly skilled surgeons? Will they be performing your surgery in a safe environment? Will you be provided with quality patient care? The answer will all be yes at St. Luke's Medical Center. Choosing a hospital could be the most important decision you'll make. Choose St. Luke's.
A fresh journey awaits you at St. Luke's Medical Center as we redefine patient experience, convenience, and eating lounges are made cozier and more comfy. We have enhanced our patient room amenities, providing new bed essentials, toiletries, special room features, room coffee and tea station, and minibar items. To give you quick access to St. Luke's concierge services, including the new and expanded St. Luke's room service menu, a digital compendium is available for you and your companions inside the room. We want to be part of your blissful milestone, so mothers giving birth at St. Luke the night prior to hospital discharge. While an exclusive, I am a thing as a welcome gift to newborns. PD patients also get special treats. Signature breakfast meals will be served to encourage and delight our young patients. For added convenience, our patient care navigators are ready to welcome and assist you, from screening to completion of care to maximize your hospital visit. With express admission, waiting time for patients who are advised to stay in the hospital is lessened. Patients get admitted directly to their rooms. No pit stops, no long queues. St. Luke's in-room discharge system makes the patient discharge process quick and convenient. Our concierge staff will visit you in your room to facilitate and complete discharge inside the room. All these new service features are implemented following strict health protocols. It is our goal experience because your comfort, convenience, and choices matter most to us. It's the quality of service you would expect in a world-class hospital, only at St. Luke's.
St. Luke's Medical Center is recognized as Philippines' leading and most respected healthcare institution. We provide services for women of all ages for the proper care of their health needs. This includes gynecologic ultrasound. St. Luke's Women's Health Center offers gynecologic ultrasound. This service helps doctors assess not only the uterus but also organs inside the pelvis. This can be performed through trans-abdominal ultrasound or trans Center also offers state-of-the-art breast imaging, from screening and diagnosis to treatment and counseling. For breast cancer screening, we offer digital 3D mammography and conventional 2D mammography. For women in high risk for breast cancer and dense breasts, screening can also be complemented with breast ultrasound. All images are interpreted by our highly trained breast radiologists. Bone densitometry can also be found at the St. Luke's Nuclear Medicine. This service helps doctors detect osteoporosis and assess for risk of fractures.
Our COVID-19 experience has opened our eyes to a lot of things. It makes us appreciate the... We know how much you've missed kisses from your loved ones, getting hugs from your friends, handshake from acquaintances, and seeing the smiles of people you encounter every day. Our situation is not easy. Thank you for the support that you've given to our healthcare workers who are risking their lives to keep us all well. Thank you for doing your share by always wearing masks and response. better tomorrow. And as we recover from this pandemic together, please know that St. Luke's Medical Center will always be open and committed to safely provide the healthcare you need. It's safe at St. Luke's.
St. Luke's Medical Center is recognized as a respected healthcare institution. We provide services for women of all ages for the proper care of their health needs. This includes gynecologic ultrasound. St. Luke's Women's Health Center offers gynecologic ultrasound. This service helps not only the uterus but also inside the pelvis. This can be performed through transabdominal ultrasound or transvaginal or transrectal ultrasound. Pap smear for cervical cancer screening. Breast imaging. St. Luke's Breast Center also offers state-of-the-art breast imaging, from screening and diagnosis counseling. For breast cancer screening, we offer digital 3D mammography. For women in high risk for breast cancer in dense breasts, screening can also be complemented with breast ultrasound. All images trained breast radiologists. Bone densitometry can also be found at the St. Luke's Nuclear Medicine. This service helps doctors detect osteoporosis and assess for risk of fractures.
Mga kababayan, ang pambansang awit ng Pilipinas. Kayang magiliw, tewas ang sinakanan, alam ng puso, sa titik mo'y buhay. Upang hinilang, tuyag ka ng magiting, sa manlulupin, di ka pasisigil, sa nagagang tutok sa simoy at sa langit ng bangaw, ay hinagang tulakaw sa pagkain. Bituin at araw niya, kailan pa may di magdidinig, lumalang araw na ang walang pagsinta, buhay langit sa piling mo. Ang higaya na pagkay mga amin, ang mamatay ng dahil sa'yo.
Our ever-loving Father, the core of every reason, the source of truth. Are the ultimate goal of every knowledge seekers, the infinite wisdom, the cause of all that is good. Grateful for this opportunity to gather together as a community this we face each day. Yet you remained and gave us strength to carry on the responsibilities of bearing intelligence and using them for better purposes. We now humbly ask you to join us in our endeavor to explore the wonders of life in the world for knowledge's sake, that in whatever we learn today, we become more grounded to you, who is truth, who is love. We pray that you bless our speakers, the fount of your infinite knowledge, that they can share something worthwhile despite the time we have, they can channel all they know and share to us the beauty and truth of living as your child. We pray that you guide our participants, the seekers of your boundless knowledge, that they may continue to persevere in the search and be deemed worthy to share what they learn from today's session. Sanctify us, O Lord, not because we are worthy of it, but because we believe in your love and mercy, that at the end of the day, we can take home something that's amazing and meaningful. This we ask and pray through Christ our Lord. Amen.
Good morning and hello to everyone. I'm Dr. Michelle Isip, the overall head of this year's OB Week 2021 Organizing Committee. Welcome to the very first Gyne Forum organized by our Department of Obstetrics and City. I would like to first of all extend my most sincere appreciation to our distinguished speakers, Dr. Joan Tan Garcia and Dr. Jennifer Jose. Thank you very much for taking time out of your busy schedules to take part in this forum and share your expertise in your field. Thank you also to Dr. Georgie Ray Matias, who will moderate this morning's activity and make it a smooth and organized one for everybody's satisfaction. This Gyne Forum was carefully and thoughtfully coined by two of our very own reproductive medicine specialists, Dr. Yvette Manalo Mendoza and Dr. Katrina Paruganan. Our aim is to reach out to you, our dear patients, in a language that you all can easily understand what menopause is, what you are going through, and what treatment modalities are available to alleviate your symptoms. That this forum will only serve as a guide and is not a substitute for your doctor's advice on your individual needs and concerns. Again, I warmly welcome you and I hope that you will learn a lot from today's event. At this point, let me turn you over to Dr. Georgie Ray Matias, one of our department's active consultants, to introduce our speakers. Thank you and have a nice day.
Good morning, everybody. It's a pleasure to be with you all today. We have a lot in store for you, so we hope you stick with us to the very end. We have two speakers who will lecture on the menopause and how to manage your problems with it. We have virtual games and, of course, raffle prizes. Before we begin, let's go through our webinar rules. Participants will be muted during the entire duration of the webinar. Questions and clarifications will be entertained at the end of the two lectures. Stay on mute. You may type in questions at the chat box. Also, this forum only serves as a guide and will not be a substitute for your doctor's advice regarding individual concerns. Lastly, do not share personal information in the forum to protect your privacy. Our first speaker today is a stalwart in Philippine climacteric medicine, or the field of menopause. May I give the virtual floor to Dr. Joan Tan Garcia.
Hello, morning. On I'm making ayos my slides. Never mind. Okay. Okay, good morning. My task is to lecture on what happens when you menopause. All women, uh, okay. Most common complaint of a menopause woman is hot flashes. What do we do when we have hot flashes? Okay, we have night sweats, you have irregular period, hormonal imbalance, insomnia. Can you hear me? Joji, am I okay?
Yes, Doctora, go ahead.
Okay. Now, okay. Ayaw mag-move yung slides ko. Okay. Ayaw mag-move yung slides ko. Hindi na nag-move ang slides ko. Malis na si Krista. Wait na. Hindi na nag-move ang slides ko. Malis na si Krista. Ayaw na mag-move yung slides ko. Ayan, okay na.
Dr. Jonathan Garcia, can you give us
Now,
5 minutes to fix the
what
audio?
happens when you have hot flashes, night sweats, what to do? Well, physically, you have to remove the stress. You have to wear layered clothing, cotton, avoid constricting clothing.
We interrupt the program for a few short minutes to fix the technical problems that we're having. We apologize.
It significantly Our COVID-19 experience has opened our eyes to a lot of things. It makes us appreciate the value of being together. It significantly changed the way we live. We know how much you've missed kisses from your loved ones, getting hugs from your friends, handshake from acquaintances, and seeing the smiles of people you encounter every day. Our situation is not easy. Thank you for the support that you've given to our healthcare workers who are risking their lives to keep us all well. Thank you for doing your share by always wearing masks and respecting our safety protocols. Distance today for a better tomorrow. And as we recover from this pandemic together, please know that St. Luke's Medical Center will always be open and committed to safely provide the healthcare you need. It's safe at St. Luke's. Is St. Luke's Medical Center safe? The answer will always be yes. It has always been that for the last 117 years. As long as you need the safest care, as long as you need quality health care, as long as your family needs the best care, St. Luke's Medical Center remains open, safe, and committed. Every single
Welcome back, Dr. Jonathan Garcia. So we'll go ahead with our lecture again.
Okay, sorry about the technical glitch. It's quite difficult, but let's go on. Well, what happens when you menopause? We all have to pass through menopause as we get old. Menopause is between 47 to 51. Okay, so, ayaw na naman mo ba? Next slide.
Gusto niyo bang ipa-present ko na lang po kay Monica yung...
Go ahead, Dr. Jonathan Garcia. We can see your slides.
Yeah, but the slide won't move. Ngayon naman, it won't move. I'm sorry, but let's see. Won't move. Oh, I have to stop share and then try again.
So while we're waiting for Dr. Jonathan Garcia, we'd like to announce that we have raffle prizes. So we have randomly selected a list of our participants of 6 of lucky winners of the personal hygiene kits from Pericone MD. May we ask the following winners to give us their contact details after the program so we may send them right at their doorstep. You can email us at productinfo@stlukes.com.ph. And please place subject Menopause Lay Forum. And of course, you need to show us your valid ID. So our raffle prizes will be given to actually our early birds. So our winners are actually Gay Bermudez, Lizelle Gutierrez, and Gemma De Castro. Again, I'll repeat. Our raffle winners are Gay Bermudez, Lizelle Gutierrez, and Gemma De Castro. Please do email us at productinfo@stlukes.com.ph with the subject heading Menopause Lay Forum and a valid ID. Thank you. We can now proceed with our lecture. Thank you so much.
Okay, so let's go on. What are the effects of early menopause? We normally start having hot flashes, night sweats, irregular periods. So those who are having menstruation every 2 months or 1 month, and then they will skip, these are called early menopause. And the most common other effect is insomnia. Ay naku, ayaw na naman. Oo. Maybe we can ask Jen to start off. Kasi I can't go on. The slide won't go down. Eh. Oo. Joji, is Jen here?
Yes,
Kasi
Dr.
I will go to the DR na lang and use
Maybe we can ask Monica to share your slides.
Oo, can Monica share the slides and then we can go on? Kasi
Okay.
my computer won't move.
Okay, Dr. Monica will
Ayan,
share.
it moved.
Just press stop share po so that Monica can share for you po. We apologize for the technical difficulties. This is our first time to have our lay forum via YouTube. But please do stick with us because we have a lot of things in store for you.
Okay, is this Monica already, no?
Yes, Doctora.
Okay.
Maybe we can start from the beginning again, Doctora.
Oh, okay. We can move on to the second slide, then the third slide. Monica. Okay, so hot flushes, night sweats, irregular period, insomnia. Next. Monica. Okay, so we have to avoid spicy food. Oops.
Doctor, there's a lag for every time she clicks. So she's just moving back to your old slide.
Okay, so you have to avoid spicy food, caffeine, alcohol, take soy, bananas, a lot of citrus fruit, do regular exercise. Next. Sorry about that. Kasi it's okay. So how do you deal? You have to wear breathable clothing, relax, eat healthily, decrease alcohol consumption. Next. Monica. Now, what are the alternative treatments? No, we are talking first the alternative because a lot of people are have wrong notions about hormone replacement. So, what are the alternative therapy? Is herbal remedies, the phytoestrogenic herbs, and it's black cohoes or remifemin, red clover, and the Bionutra Newfem. The hormone regulating herbs is macafen. Next, the best way to treat hot flashes is hormone replacement therapy with the use of different, whether it's a patch, it's a gel, it's an injectable, or it comes in a pill form, no? So you can see on the right, it has various forms, no? And then there is also a transvaginal for those with atrophic vaginitis. Then we have your selective serotonin reuptake inhibitor, BP medications, sedatives, and seizure disorders. These are all to be prescribed by a doctor after you have consulted. It is very important. Next slide. So, what other problem is involved in when you are talking about menopause? Loss of libido. So, hormonal balance predominantly is due to androgen deficiency. So, you have to take either fennel, kava, yohim, damiana, black cohoes, garlic, cacao. Okay, so you don't have to sit in the bed or waiting for your husband to start snoring before you go back because you dread the time you are spent with him. Next. The best remedy for loss of libido, next, uh, is to take those hormone treatment or those supplements that I have mentioned. The lifestyle changes when you get panic attacks. That's another complaint of a lot of menopausal women. You have to diet and exercise, talk to a trusted friend or support group, do some stretch management, relaxation technique like yoga, meditation, breathing techniques, visualization. Next slide. And the other thing to do is you have to stay well hydrated. Eat more complex carbohydrates, which increase your serotonin levels in the brain. Eat small, more frequent meals to avoid low blood sugar. So instead of 3 meals a day, you may have to opt for 5 meals. And you have to increase your tryptophan found in milk, banana, soy, nuts, peanut butter, and oats. Definitely coffee is not ideal for these people. No, they become jittery. And then you can consume some phytoestrogenic food like tofu, apples, lentils, and flaxseed. Next. Then the other one is next. There are alternative medicines for that, no? They are as follows, as you can see, the difference. Then you can even What is available in Mercury now is the BioNutran Nufem, which you will take one capsule twice a day to relieve you of the hot flushes. It's not hormonal, it's more of herbal. The other thing is, of course, the mainstay is hormone replacement therapy, sedatives, anxiety medication, and SSRI. Next. So your panic attacks can be covered by this medicine. And what is the other complaint? They experience depression. They have mood swings during menopause. Next. There's a roller coaster of emotions. Okay, next. And the hormone imbalance is due to the lack of serotonin. And it is caused by smoking, alcoholic consumption, poor diet, inadequate exercise, and stimulant use like smoking, like alcohol drinking. No? Health factors, you have to check if you have diabetes, thyroid disease, you have heart disease, you have sleep disorder, or in certain cases, cancer and lupus. Next slide. What to do? Exercise. Back to it. Exercise. And you have to choose your diet. Next slide. So what happens naman if you are having a trouble remembering? You go to a room and you cannot remember what you were going to get in that room. Well, that is actually part and parcel of menopause because you lack estrogen. Estrogen is affecting our brain activity. So all in all, the deficiency of estrogen has this effect. Next slide. Part of it is drug use. What medicine are you taking? You have to ask your doctor, do they cause you to have memory loss? Or is it because you are doing, like different diets, and each diet has its different problems, no? And possibly you may have neurological disorder. You may be having a stroke or something. So you have to look into it. Don't think of it just, well, it's something expected. That's true, but you can do something about it. So you have to have lifestyle change, eat healthily, cut back caffeine, alcohol again, and a lot of sugar. We know sugar is the main cause of cancer developing, and the lack of sleep, the stress. And if you want to improve your brain, you can do some brain exercises. Okay, you can go to the internet and look for them. And then, of course, then aerobic exercise. Next. Next. So here we have a list of medicine that causes concentration. So you have to do yoga, you have to meditate, you have to take vitamins, which has a lot of minerals and low in fat, and of course, estrogen replacement. If you don't want it, you can avoid drugs, get a hobby, focus on one task at a time, learn new things one step at a time, and of course, remove or banish stress. Next. That would improve your concentration. Next. And you have to cook with good fats. Don't recook the same cooking oil that you fried, no? You have to cook it well and then go back. So eat well. You see, avocado is now in season. Salmon is always readily available. You have to get a good night's sleep. That means at least 5 to 6 hours, no? Because we know that menopause women don't get enough sleep. So try to sleep. In the afternoon, you get some naps to replace the lack, okay? And then most especially, spend time with your loved ones. Being happy reduces your memory loss. Next. Next. Okay, so here we are. Dizziness. What happens when you get dizzy? It's parcel of menopause. Yes, it may be, but it may be not, no? So these are all the symptoms on the left of your dizziness. And what do? You do hot flushes. You do what do? You lower your blood pressure. You check if you have anxiety, panic disorder. If you're dehydrated, we all have to be hydrated. We have to take 2.5 to 3 liters of water a day. And then if you're sitting on your computer for a long time, you may develop arthritis of the neck. And that needs physical therapy. And of course, if you have heart problems or stroke, minor it may be, it still needs an attention. Next. So we go, that's the dizziness. You have to check, is it eyesight? Is it the heart? Is it the inner ear? Is it the sensory nerve? Next. Next, Monica. Okay, what do you do? The same. Exercise, hydrate, eat healthily, lifestyle change. You have to make sure that they are checked. After you have checked that the heart and the neurologic factors are not involved. Next. So avoid alcohol and tobacco. Eat lots of citrus fruit, avoid caffeine. And then you can take tea with the use of either basil, dandelion, peppermint, ginger with cinnamon, ginkgo biloba, and of course, my favorite, the hormone replacement therapy. Next. This is another problem. I do have it. I feel bloated. I will burp. I have a lot of flatulence. Next slide. What do? You have to discuss, you have to check on your food. Does your food mainly is cabbage, cauliflower, beans, oats, apple, milk, fluffy wheat? Is it broccoli, onions, corn, potatoes, pears, soft cheese, and peaches? If they are, these are the common foods that cause bloating sensation and gas formation in your GI tract. Next slide. So, back to normal, you have to avoid eating those food. You have to relax, you have to exercise, and you keep a diary. Like I found out I am allergic to watermelon. Every time I take watermelon, I would bloat and I would have to go to the toilet and puke. So consistently, when I was young, it wasn't that way. Next. So you keep a diary. Okay, oops, go next. We are talking about the atrophic vulva. Next. So atrophic vulva, menopause women, they usually have bacterial vaginosis. Then the next is the vulvovaginal candidiasis. Because we have sugar concern, we are usually having UTI and we take antibiotics. So we develop candida, vulva vaginal candidiasis. And the less frequent is your trichomonas and the others. No? Next slide. Okay. So if you have a fishy odor, something that smells, you may have bacterial vaginosis. Next slide. Okay. What causes atrophic vaginitis? Definitely menopause. When you lose your estrogen, you have decreased ovarian function. You had your ovaries or your uterus and both of them removed. And if you are taking tamoxifen, which is a anti-cancer drug for breast cancer, no? People who smoke, they have earlier menopause by 3 to 5 years. So women, as you reach menopause, please do not smoke or cut down your smoking or stop smoking, and then so that you will have a better vagina, no? Now, if you don't have sex, nothing goes in and out, massaging it, that would also cause atrophic vaginitis. Next. So the treatment is estrogen treatment. The nice thing about estrogen treatment, it does not affect the uterus. So you can put your estradiol vaginal cream, known as estriol, known as Ovestine, or you can use your primary cream or your isoflab gel. Next. What kind of feminine wash for menopause? Definitely, I would recommend Dove unscented soap. Something without a smell, something that is 100% as much as possible without chemicals, and something that is neutral, good for our vagina or for our vulva. Next. Another frequent problem is urinary incontinence. Okay, there is loss of tone, there's too much activity, and you just can't hold the urine. Next slide. So next slide, you will see a person crossing their legs, running, squeezing. Next. And you have a hard time. So here you need a Kegel's exercise, you need a vaginal estrogen local treatment, and you have to ask your, you have to do your massage, or your husband has to do it for you, no? When you have sex. Now, the sex now is a problem. What if the husband goes to sleep and you don't want sex because it's painful and it causes a lot of disorders? Next. You go to the bedroom, you refuse, you have pain. Next. So the treatment is actually just plain and only normal vaginal cream, no? So you have to look at these various factors that causes female sexual dysfunction. Is it organic? Is it psychological? Is it relationship level? Is it loss of social cultural factors? Next. So stress is the #1 effect, that sex drive killer. You have to learn how to handle your stress level in a healthy way. So if you need help, you have to ask a doctor or a counselor to help you. Next. If you have problems with your partner, you have to solve that problem. They always say, don't go to sleep with your having a problem with your husband. Better watch out for all those signs, and you are back together. Next. Those people who like to drink, they may feel more open to sex, they think. But actually, too much alcohol will turn you off. Next. Too little sleep, likewise, no? So sleep more. Next. This is one picture that I think a lot of us have. You know, our children sleep with us. It's okay when there's a baby, but when they're more mature, they know what we're doing, and it's not good. So you should not have those kids in between you or sharing the bedroom. If you have to, give them another room rather than doing it during when the time that they're asleep. Next slide. Next. Certain medicines also will affect. And then poor body image. If you look at your mirror, you see yourself very fat, you feel very low, you have a low esteem, that will also affect you. Next. Next. So overweight will be one. So you have to try to cut down. And then if your husband has ED, you have to consult a doctor so that ED can be treated and can be corrected. Next. Of course, we should not forget menopause by itself is a sex drive killer. So better take something to hormone replacement or all those alternative therapies that can improve you. And then encourage your husband or your partner to have regular sex with you. It will be much more rewarding. Next. I think it's the last slide. Okay. So what are the effective treatments? Okay. You can use KY, but I do not encourage my patients to use KY because it dries up. The best is the Ovestin cream, which you can find in MD Express in another hospital. And then, of course, the pills. And then, can you use water-based lubricants? Yes, of course. It will relieve the vaginal dryness when you massage it in. Okay, next. Okay, lack of closeness. You have to have time with your husband. Next. Talk, snuggle, trade massage, find ways to express love. Swimming is another one. For this is not the time, but if you have time or the pool is to yourself, you can do swimming. It's outdoor. Okay, it will boost your endurance, your blood flow, strengthens flexibility and strength, and it slashes out stress. Okay, and for men who are obese with erectile dysfunction, this will help. Next. Being together. This picture shows you that you do almost of the things together. Okay, next. Oh, this is one very important. Kegels exercise. You have to hold back your urine. You tighten up your lower abdomen. You will see that you will be able to strengthen your lower abdominal muscles and your vagina. Try holding on to your urine. Hold it back. That is what we call Kegels. And do the Kegels 10 counts. So 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. And then release. Then do it again. Some women have to do it more frequently, like 40 to 50 times a day. You can do it separately, 20 times now in the morning, 20 times the afternoon, and another 20 times at bedtime. So if you want to know you're effective, you can put a finger in your vagina and you can feel the pulling up when you squeeze. Next. So let me stress, you have to eat more healthy food. It will help your memory. It will help your body. And of course, it will have a great benefit for your brain. Next. Play with the dog. If you don't have, your children are all adult, you're a grandmother. So people with cats and dogs seem to have lower cholesterol, less risk of heart disease. They also need fewer doctor's visits. So we don't know why pets seem to help, but it brings happiness, I think. And having a dog that needs walk is a great way to build a daily exercise. Next. So eat smart. Take dark green leafy vegetable, fruits and vegetables. Okay. Choose the food that is packed with nutrients. Cut down on empty calories. Don't eat junk food. No. So goodbye Lay's, goodbye Pringles. Okay, next. And next. Stay on balance. Do your yoga. Exercise. Okay. Zumba would be nice if you are still able to exercise as much, but yoga or Tai Chi is the best. Next. How do you fend off wrinkles? You make sure you put sunscreen every day. It really does prevent wrinkles. And you have to look at it. It should be SPF 30. And then you have to do it twice or thrice in a day if you're under the sun. Because if you put SPF 30, it would last you only for 4 hours, maximum of 5. No? So if you have to spend for your wrinkles, use sunscreen. Next. Sleep, sleep, sleep. Next. Okay. And let me warn you again. Let me reiterate. Exercise, being together, having fun, and being close to each other. If you need a massage, ask your husband to massage, and you will have a better and closer relationship and a healthy menopause period. Thank you very much for your attention. I think that's my last slide. And I apologize for the technical difficulties. Thank you, and stay healthy.
Thank you, Dr. John Tan Garcia, for that very informative lecture on how to deal with menopause in a holistic manner. Before we begin with our next lecture, of course, we will go to our anticipated raffle prizes. We'd like to remind our winners to please email productinfo@stlukes.com.ph with the subject Menopause Late. I apologize, I was on mute. Thank you, Dr. John Tan Garcia, for that very informative lecture of how to deal with menopause in a very holistic manner. Before we proceed to our next lecture, we would like to again give out prizes to our audience. Please email productinfo@stlukes.com.ph with the subject Menopause Lay Forum. Please do include a picture of your valid ID. Our next winners are Ana Pareño, Filomena de Guzman, and Rebecca Samonte. Again, I'd like to repeat our winners: Ana Pareño, Filomena de Guzman, and Rebecca Samonte. Our next lecture is in line with the theme of the celebration of OB Week in St. Luke's Medical Center QC, which is the paradigm shifts in women's health. Our next speaker will discuss the new modalities in the treatment of menopausal symptoms. Dr. Jennifer Marie Jose is actually a pioneer in aesthetic gynecology. May I give the floor to Dr. Jenny Jose. Thank you.
Good morning. Can you see my slide well? Okay, there you go. Okay.
Yes, Dr. Jenny, we can see your slides.
Thank you. So my topic this morning is new modalities in the treatment of menopausal symptoms. Okay, so we have talked about menopause. It is the cessation of ovarian function, decrease of estrogen levels, and increase of gonadotrophin levels. And Dr. Joan Tan Garcia has explained menopause very well. Now, I would like to center on the vagina. What happens to the vagina when we reach menopause? You can see here that I have emphasized vaginal dryness, dyspareunia, and also urogenital atrophy. Okay. Look at the postmenopausal pathologies and look at the percentages, right? Look at the one at the bottom. We have urogenital atrophy and it is 100%. It's like saying that all women who will undergo menopause, and that is all of us, will experience the effects of urogenital atrophy compared to the other pathologies. Okay. Now, if you look at this maturation index, what happens in the vaginal tissue when we reach menopause? There is actually increase in the parabasal cells, okay? When there is an increase in the parabasal cells, what happens is that the vaginal tissues becomes dry, it loses its glycogen, it becomes not lubricated, it is irritated, and this causes a lot of symptoms, which I will be showing in the succeeding slides. Okay. Look at the changes in the vagina. I'm sure a lot of us can actually relate on this. First, we will be experiencing vaginal dryness, vaginal irritation or itching. There will be vaginal discharge. A lot of people will have issues with intercourse. They would have pain when they urinate. They will have changes when they urinate. They will go to the washroom more frequently. It's like going to the washroom more than 8 times a day, and then they start having leaks. So what happens is that when they cough, when they sneeze, and when they laugh, they leak urine. Okay. But of course, we do not like that. We have to keep ourselves young. We have to regenerate our tissues, and therefore we become fresh again, and we are actually improving our quality of life. So this is what we want, and this is the reason that's why we are attending this forum. Okay. What happens with childbirth? We know very well that when we do vaginal deliveries and we keep on straining, of course, there will be tears in the vagina. There will be break in the pericervical fascia and also the rectovaginal fascia, which you do not see. But in the long run, what happens is that this would actually lead to vaginal laxity, okay? Everything will try to come down. Everything will fall down, okay? So look what happens to the aging vagina. I have mentioned about dryness. It becomes atrophic. It sags and it drops. You develop urinary incontinence. You develop prolapse, or what we call BUA. You develop overactive bladder. What is overactive bladder? When you have a little amount of urine in the bladder, you feel like you want to go. So you have feeling of urgency, frequency, and also nocturia, even if you don't have urinary infection. Then you can also have problems in reaching orgasm. A lot of women has these problems, okay? You develop repetitive urinary tract infection and repetitive vaginal infection, okay? So this is what happens as we age. We have the genitourinary syndrome of menopause, okay? We have the vaginal relaxation syndrome and also stress urinary incontinence. I'm sure a lot of you who are listening right now can actually relate to what I'm saying. Okay. So now we have the energy-based devices. We have the CO2 lasers and also the erbium YAG lasers, which can help us in the treatment of all the symptoms. Okay. What are the 5 most common problems that we experience right now? These are the complaints of women. Okay. First, as I've mentioned, vaginal laxity and pelvic support defects. This happens when we marry early, we deliver big babies, and when we have multiple pregnancies. Look, the face of this woman is actually sagging in time. So what happens to the pelvis too, it also sags in time. Okay. Then we develop our leaking, right? When you cough, when you sneeze, and when you laugh, even if you cross your legs, you leak. Okay. Look at this. 1 in 4 women suffer from urinary incontinence. That is actually a big proportion of women having this incontinence. And the problem is, majority of us thinks that incontinence is a normal part of aging. But actually, we can actually help ourselves not have incontinence and have a better quality of life. Okay. Of course, what happens right now is that majority of these women in the perimenopausal to the menopausal age group, they wear pads, okay, or they wear diapers. But we do not want to wear these diapers, right? We want to grow old gracefully. So what else? Look, a lot of us have this pain or discomfort, especially during intercourse. Some would even have vaginismus. This vaginismus can happen not only during the first intercourse, but it can happen with time. Why? Because remember, because of the atrophic changes, you become dry down there. You become dry in the vagina and it becomes painful. And because of this dryness, some of these pelvic muscles you can actually contract because of the pain. And therefore, penetration cannot happen. So what we do, just to let you know, we actually give Botox or inject Botox to the pelvic floor muscles to relax the vagina. Okay. A lot of us are actually embarrassed with the appearance of the vagina in time. Why? Because we want the contour to be smooth and pleasing. The color should be consistent and matching on both sides. And of course, the labia should be symmetrical, okay? So both sides should actually look alike. Okay. What else? Okay. Look at this video over here. Women would prefer that their inner labia is smaller and the outer labia to be puffy. I don't know if you're very conscious about it, but I've seen a lot of women having this complaint, okay? And then at the same time, we want the edges to be smooth. The natural look should have smooth edges, okay? So of course, okay, remember, your face is your first face, and your vulva and the vagina, you consider it as your second face, okay? That's why we have to take care of it. We have to feel confident about ourselves as we grow old, okay? Look at this slide, the sensation during sex. What happens when you have vaginal laxity? I hear this from a lot of women. They say that sex doesn't feel the same anymore because the vagina is lax, okay? So we need to help these women. Now that we know all of this, it's good that we are aware about this problem so that we can help ourselves and also help our colleagues and also our friends. Okay, I'd like to show you the current treatment options and also the breakthrough technology, okay? With regards to the genitourinary syndrome of menopause, it is actually a prevalent condition. It happens to all women. And now, because of increasing female life expectancy, before they say that, that the life expectancy is only up to the age of 65. And if you are older than 65, what happens is that it's a bonus. But now women live longer. And this will definitely affect more women because there are more women now and more women live longer and they want an improved quality of life, okay? Now, a lot of patients are expressing concerns about overlap of efficacy, tolerability, and the acceptability of these treatments. Now, there is a sufficient growing data on the use of lasers for the treatment of genitourinary syndrome of menopause. And laser is an efficacious and a long-lasting treatment, okay, that is available in our country. This is now being offered as a first-line treatment for patients with genitourinary syndrome of menopause, okay. We can see here that the NICE, National Institute for Health and Care Excellence, they are actually looking at the acceptance of transvaginal laser for stress incontinence and urogenital atrophy, which is now approved. So this slide shows the acceptance of lasers by med regulators and the scientific community, okay? And it is also accepted that this laser therapy is given for those women who have recent onset of menopause to those who have late stage of menopause. You can actually give it also as prophylaxis so that it doesn't worsen in time. I mean the conditions, okay? So the genitourinary syndrome of menopause is a chronic progressive condition frequently manifesting as vaginal dryness and pain with intercourse. And this is the most common complaint. And survey data indicate that this is highly prevalent, as I explained. It is underreported, and this condition profoundly affects the quality of life of women. And these vaginal lasers demonstrate promise as an effective non-hormonal therapeutic alternative for GSM. Okay. It has been published in different journals already for about 10 years, okay? And you can see in this slide that there are a lot of patients being treated with lasers with very good results too. Look at the efficacy outcomes. The CO2 and the erbium-YAG laser have shown promise in the treatment of vulvovaginal atrophy, dryness, menopausal dyspareunia, which benefits lasting up to 1 year. So when we offer this to patients, okay, we do this every year, but you don't need to do 3 sessions every year. What we can do and what is actually published as a protocol is to have like a memory dose yearly. But in my practice, this is what I've seen with patients. Normally, they come and see me not after a year, but after 2 years because they still felt lubricated and they don't have any complaints, okay? This has been approved, okay, by different countries already for the treatment of stress incontinence, vaginal relaxation syndrome, genitourinary syndrome of menopause, okay? And you can see that a lot of countries have adapted this in their practice too. So these lasers are actually in-office procedure. It is actually painless. It has quick healing and no downtime. This is very good for tightening, for mild incontinence, moderate incontinence, genitourinary syndrome of menopause, as mentioned, those who have cancer, those who needs lubrication, those who needs to be rehabilitated after delivery, those who have vaginal infection, vulvar vestibulitis syndrome, and also lichen sclerosis. It has a lot of application. And it's just like having a transvaginal ultrasound. We put the probe inside the vagina and then the laser is being done. What can you see here? You can see that when the laser is done, there is improvement in the collagen and elastin fibers. The tissues doesn't become thin anymore. It becomes thick. There is more blood supply and more nerve supply as well. And there is tissue remodeling. At the same time, when you use this laser, there is improvement or increase in the blood vessels, increase in microvascularization, increase in oxygenation, tissue lubrication, and also vaginal sensitivity. It also decreases the vaginal pH, and therefore, what happens is that the vagina becomes acidic again, which is good because therefore we are also protecting ourselves from vaginal infection, which can also lead to urinary tract infection. Now, these are the possible side effects, but I tell you, it's very, very minimal, and the patients do not complain about it. Okay. This is the effect of the CO2 lasers. It actually creates minute pores, and there are small holes in it, and it contracts. And because of that, you won't even see it, you won't even feel it, but this is actually very good for vaginal laxity treatment and also to stimulate the regeneration of tissues. Okay. Because of this thermal effect, the heating promotes improved tissue growth, and therefore there will be superficial shrinkage, there will be a deep aseptic wound, and then the collagen remodels. You can see that we have three phases. The first phase, there will be edema, slight edema, which you wouldn't even feel, and then there will be collagen shrinkage. And the second phase, there will be new collagen formation. And then the third phase, what happens is that the collagen and elastin fibers regenerate. And after that, the collagen and elastin fibers continues to regenerate even if you don't apply lasers. Now, because of this treatment, the heat shock proteins are actually activated. And these paracrine cells will signal other wound cells to activate. And therefore, the macrophages are there, the myofibroblasts will actually be stimulated, and the collagen will actually form. Now, if you look at the slide on the left, we have the different growth factors which will also help in the wound healing. I don't know if you're familiar with the platelet-rich factor. This is actually the wonder medicine that is featured in Time magazine, I think a year ago, that this is used by the orthopedic surgeons for the knees, the dermatologist for the face, and this helps in the regeneration of tissues because this is very rich in growth factors. We also do this in the vagina, which I will show you later. Okay, so after the treatment of laser, you can see that there is collagen remodeling and fibroblast proliferation. I have mentioned to you already that this is an in-office procedure, and because of the laser light energy, there is a photothermal effect, there will be vasodilation and edema, and therefore more formation of fibroblast proliferation and collagen formation. And you can see the restructuring, resynthesis of the collagen, increase in oxygenation, increase in the blood vessel formation, and collagen buildup. So I have mentioned to you already the effect of the CO2 laser, which reaches the deeper muscles, okay? And after that, I also have mentioned to you the side effects, which are not very pronounced. The patient wouldn't even feel it. And if ever there is a side effect, it is actually very manageable because this is what we want. We want to regenerate and feel good about our second phase, okay? So for those who have breast cancer, studies have shown that 50 to 70% of these patients experience one or more symptoms of urogenital atrophy. I have mentioned to you that when we do lasers, we give it 3 sessions 1 month apart. And you can see that these symptoms of these patients are actually improved in time, right? So the dryness, the itching, the dyspareunia, and dysuria is actually improved in time. Now, patients would also complain of vulvar laxity and vaginal laxity. Of course, we don't want our vulva to look like this. We want it to be pretty again, right? And our lasers can actually do radio frequency effect in the vulva to make it pretty again as well. With some cases, we need to do labiaplasty, meaning we need to do some surgery, and these lasers can also help. So there is no cutting, okay? And there is no downtime as well, and we can reshape the labia. This is the PRP, which I'm telling you, we get blood from the patient and then we centrifuge. We get the clear portion of the blood, which is very rich in growth factor. And that blood, the clear portion, it's called serum, is the one that is being flushed into the vagina to regenerate the tissue, okay? For some patients, of course, they have complaints in the G-spot or also the O-shot because they don't feel orgasm anymore because of the menopausal problem, right? Lack of estrogen. So we inject the PRP in certain areas to make them sensitive again, okay? And of course, look, why are we dealing with this? It's not only functional. I have told you already the reasons as why we need to address this, but it also has aesthetic reasons as well. Now, these patients are thinking, is it luxury or necessity? Well, first, patients would say that they want to do this and make themselves pretty down there again because of they want to have a heightened sexual pleasure and they want a youthful looking vagina, okay? They want to develop self-confidence again, and this will improve their marital relationship. They just want to do it for themselves and they say, hey, I've done everything for my family. Now it's me time. That's why I need to do this. And they find themselves less attractive and now they want to be attractive to their husbands again. I have mentioned to you about UTI, and there are also studies now showing that when you do laser, since you improve the trophism in the vagina, then the chances of UTI is actually decreased, which I've seen with my patients as well, okay? With regards to leaking or stress urinary incontinence, what happens with urogenital atrophy? There is decreased blood flow, okay? The urethra, where the urine comes out, becomes smaller, thinner. The caliber becomes very thin, so the opening becomes bigger, okay? Because the collagen has decreased in time. And that is because of what we call the ISD or intrinsic sphincter deficiency, meaning the urethra is open even at rest, okay? And we need to improve on that, okay? So here, this is what happens. Look at the left side of the screen. You can see that the urethra is open, but after doing laser, you can see that there is improvement in the trophism or the opening of the urethra. There are 2 types of incontinence. You have urethral hypermobility and intrinsic sphincter deficiency. The intrinsic sphincter deficiency is the one that is more prominent because of the menopause. And when you do laser in the vagina, okay, it will actually pull the sagging structures. That's why there is less urethral hypermobility and the patients would have improvement in terms of incontinence symptoms, okay? And this erbium YAG laser is very good because it has the power, it has the ability to address incontinence, okay? We have a urethral probe that we insert in the urethra to improve the collagen of the urethra, okay? So this is actually very good and this is non-invasive because it's not only the muscle that we're taking care of, okay? But we are also taking care of the mucosa and the submucosal vascular supply, okay? And after doing this laser, you can see that the collagen has actually improved. The blood supply has also improved as well. And you can see that the tissues becomes more healthy and there is more glycogen in the tissues. So look at the 1R pad test, okay? Before treatment, it's 64 grams, but after 1 session of laser, it becomes lighter, meaning less leakage. And after 2 sessions, which is 12 weeks after, you see it's only 20 grams. So you can see that the quality of life of patients has actually improved. And those symptoms of urinary frequency and also the volume of urinary leakage has decreased, okay? And just to let you know, we also have the high FM technology. This is an electromagnetic chair. When you sit on it, it's like doing 11,200 Kegels in 28 minutes. I know very well that everybody has to do Kegels, but I'm also in the reality side that not everybody can do Kegels 10 times in the morning, 10 times at lunch, and 10 times at dinner time. So this machine can help us achieve the contraction of the pelvic floor muscles to tone up our pelvic floor muscles, okay? And what does this electromagnetic chair do? This actually depolarizes the pelvic floor muscles, and this is actually very good for urinary incontinence, for defecation problems, even for sexual dysfunction. Because of the contraction of the pelvic floor muscles, there will be improvement of the blood supply and also of the nerve supply. I have also helped some patients who have difficulty in urinating, those who cannot empty their bladder, they are actually being helped to with this treatment, okay? And with this, it's like a walk-in, walk-out procedure. You just have to sit in it, okay? So this is actually very good for childbirth, aging, and menopause. And of course, those patients who are starting to have a weakened backboard and they become incontinent, okay? So we want to re-educate the pelvic floor muscles. And it's not painful. We taught you already, and you know how to do the Kegels exercise. Remember, when you do Kegels exercise, it's like trying to pull your vagina to your tonsils. If you're able to do that, then you're good, but it has to be the proper way. This machine can actually do supramaximal contractions, and therefore we get better. Thank you.
Thank you, Dr. Jenny Jose, for helping us understand the new modalities in the treatment of menopausal symptoms. We're so excited to hear those new gadgets and new things. We will now proceed to our open forum. May we ask our participants to type your questions in the chat box. There are some questions that are already answered, but for the benefit of the other participants, of course, I'll repeat it again. Okay, so our first question may be for Dr. Joanne Tan Garcia. If your budget only allows one supplement, what would you recommend?
Well, definitely because with the deficiency, the syndrome of menopause is actually due to the lack or deficiency of estrogen. So if you lack estrogen, you have to replace it with estrogen. And the one that is available in the market, which is safe for those with intact uterus, would be Tibolone, which has three components. It has alpha, it has beta, and it has delta 4, which comprises estrogen, progesterone, and androgen. So it will solve the problem for everything. So name niya Tibolone. It comes in a there's only one brand in the market naman. You just ask Mercury. If that is the question for it, no?
How about herbal supplement, Dr. What would you recommend?
Herbal supplement for hot flashes would be BioNutra Nufem. We did the study here in St. Luke's in 2005 to 2006, I think, no? And it was published in 2009 in the North American Journal. We found that more than 50% of patients were relieved already by the end of the 6 weeks. And on the 12th week, most of them, no? So I would go for BioNutra Nufem. It has also vaginal benefit, as in causes the vagina to be more wet. It solves the problem of incontinence, which is more or less the result of estrogen deficiency.
So how do you take the BioNutrifem, Dr.?
Well, initially, the recommended is 1 capsule twice a day. But if you're with the severe symptoms, you should take it 2 capsules in the morning and 2 capsules at night. And if after 1 week, as most of the participants in the study has been relieved, you can go down to 1 capsule twice a day. And you take it for as long as you want, but normally we recommend only for 12 weeks. After 12 weeks, you're fine. If you need one more because you resume having hot flashes, you take it again.
How about, Doctor, a herbal supplement for anxiety? You mentioned a few herbal supplements, but among those, which would you recommend?
So herbal, I think the best is the one that is the tea. The basil, dandelion, yung mga tea, they will be the best. Chamomile, yung mga tea. If you are a tea drinker, it's good. But if you're not a tea drinker, it will be bad, no? It will be difficult.
Okay, thank you. So you answered this one already, but of course, I'd like to repeat it again. Instead of sunscreen for avoiding wrinkles, can you use olive oil or VCO?
I have patients who did that. They use olive oil, they use BCO. They develop pimples on their face kasi you remember we have skin pores. It gets clogged up by them. Now, for your skin on the body, it's okay. But for the face, I don't think it is good, no? Now, for the vagina, it has been said that it helps, no? But it's messy. Olive oil maybe, yes, it will not be messy, but BCO is a little messy and it has certain odor, which for me, it's okay, but some people will not like the odor of BCO. And I think there's a question on if you're 40s, okay, can you do
Yes,
that?
Doctor.
Oo. If you're, kasi we have encountered people who are 40s who are having estrogen deficiency. So it's best that with this, even if you're still menstruating, you already start taking some supplements to cover up for the deficiency because it fluctuates. And then evening primrose, what we normally use in the past, kasi evening primrose, for your information or the rest, it's vitamin B6. No, B6.
They're talking about
B9
vaginas.
Oo. Parang evening primrose is for, we use it to induce labor, we use it to open up the cervix. Pero there has been studies undertaken by some authors, marami na actually. They say that it has no benefit for hot flushes, for night sweats. So I would tend to believe them because it's a quite robust study with a large number of population involved. So if you want to use evening primrose, it's not for anything. I'm taking evening primrose because I lack that, ano yun eh, one of the vitamins that was checked. Kulang ako, kasi hindi ba yung 1, 6, 12, o 3, omega pala, omega 6 pala siya, sorry. Omega 6, kulang ako sa omega 6, so I'm taking my omega 6 as evening primrose to supplement, to protect my heart and my and the rest of my body. But for hot flashes, it doesn't relieve.
Would you recommend routine screening for what you did po, what you measured sa blood? Or no naman? Like for example, yung mga vitamin D measurement, do you recommend?
Kasi only few centers do that. High precision and then the biobalance.
Of course,
They're
also
the only two laboratories that do it. And it usually comes in a package. It's quite expensive. So if you want to take it, it has no harm to take it. It does not have harm if you overdose or something. You cannot swallow naman so plenty. Evening primrose, medyo if you get the imported one, but the local one is so small lang, it's easy to go in, no? Does it deal vaginal dryness? Siguro it does kasi we are using it to do the to make the cervix open, to soften up the cervix during labor. Siguro bago kunyari, post-dated, yung petsa ng panganakan mo was 1 week ago. You put in evening primrose to soften the cervix so that the cervix will open up and the baby can come out. But for vaginal dryness, I think it must have, kasi oil siya eh. Remember, any oil would help for your vaginal dryness.
Thank you, Doctora. We have a question here for Dr. Jenny Jose. How long is the downtime after laser therapy?
Oh, in terms of what? Like, it's an in-office procedure, so you can actually continue what you're supposed to do during the day. It's just like 3 to 5 minutes.
That's good to hear. So how long is the treatment per treatment?
Okay, the treatment per session is like 5 minutes. But of course, if you are menopause and your tissues are very dry, I add PRP or platelet-rich plasma. So I will add an additional 8 minutes because I need to extract blood from you, and then we need to centrifuge and flush the plasma right after the procedure. So probably in 10 minutes time, you're done.
So like they can just take their break from their office and then just go to your clinic and then go back as if nothing happened, right?
Yes, yes.
Yeah, that's good. That's good. It's actually something, of course, these things are kind of hard to do right now when you're in the pandemic. But of course, later on, as our economy opens up, we can actually go back to St. Luke's, still do those procedures after the quarantine period, right, Doctora? So if, for example, is there anything like side effects that they can feel? Is there a burning sensation afterwards?
Actually, none, because what's so nice about it is that normally, if you're going to look at the literature, you have to, refrain from course for 3 days. Because remember, like what I showed in the slide, the first session, you will have a bit of edema. But it's so surprising because these patients even call me late at night and they said that they had intercourse during the time. And it's okay. So I guess it's just all right.
So like how often can they do that? Like you mentioned, it's like it lasts for a year and then after a year they can do that again?
Yes. Actually, the protocol says is that you do it for 3 sessions, 1 month apart. And then after those 3 sessions, you're going to be all right. So after 1 year, you just need 1 dose. And I call it a memory dose because you need only 1 out of the 3 just to continue the regeneration. But so far with the patients that I've seen in the clinic, they are still okay after 1 year. They actually approached me after 2 years and they said, can I have my memory dose? So that's the time that I give the memory dose.
Para pala mga booster vaccines yan, ano? Kailangan titingnan muna kung may effect pa.
Yes, because we also grow old, right? So we need to, yeah.
How about HIFEM, Doctora? How long does it take, the HIFEM?
Because when you sit in that chair, it will take 28 minutes, right?
Oh, so slightly longer.
Yeah, so you have to allot, let's say, 30 minutes for you to sit on that chair.
How about labioplasty, Doctora? How long do they have to wait for the recovery period? Is it the same as the others where come and go?
Well, actually, they can come and go. I just had one procedure. I just did her, and then she stayed in the recovery room for 2 hours, and then she didn't go home. The vagina has a lot of blood supply. The vulva has a lot of blood supply. So, they recover very fast. And then they come see me in the clinic after 1 week.
Okay. So how long before they can resume sexual intercourse after labioplasty?
Oh, okay. Because of course you want to keep it nice. I tell them you have to give time for your tissues to heal. Let's say a month or a month and a half.
Oh, parang nanganak din pala, no?
Oh, yes, yes. And of course we want it pretty, right? So we have to, and there is also inflammation too and some swelling. So we have to give it a little time to, go back to its normal.
Okay, so we have a question here from one of our participants. Are the treatments for vaginal leakage, CO2 laser, and HIFEM covered by HMO? And how often should we have urinalysis done aside from the usual annual checkup?
Oh, I think the urinalysis, you should do it every year with your annual checkup. But whenever you have symptoms of the irritative bladder, symptoms such as urgency, frequency, and nocturia, it's good to have a urinalysis so that if you have an infection, you get treated right away. But if these treatments are covered by HMO, I know it is not covered, but it is covered by other insurances already.
Okay, thank you.
Maybe
Thank you
in
for
time,
that.
because it's still new.
Okay. So one question, is it possible for a 40-year-old to go on menopause, especially if experiencing all the menopausal symptoms?
Yes. Yes, because remember what is menopause? No menses for a year, right? So it can
Yeah.
happen.
Okay. Is it possible to experience menopause later than 51 years old?
Yes. We've seen some patients that they're still regularly menstruating even after 51 years of age.
Is the laser treatment safe for women with diabetes? Is there any contraindication for the laser treatment?
For the laser treatment, there is no contraindication. But I think what I think is very important is that, this should be done by obstetrician and gynecologists, because you have to inspect the vagina first. You have to have a pap smear first and make sure that, everything is all right before you do any lasers in the vagina. So I am a firm believer that it has to be done by a gynecologist.
Thank you, Doctora. Of course, we highlight the importance that it has to be done by a gynecologist and not just, one of those aesthetic fly by night, right? That's why it's important to go to St. Luke's.
Yeah.
Okay, so maybe a question for Dr. Joanne Tan Garcia. When should I start taking estrogen pills, and when to stop it? Like how many years? Of course, any of the answers here should be, again, you have to get in touch with your OBGYN. But of course, Dr. can answer in an academic point of view.
To be guided, you have to know when do you start. The minute you start having hot flashes, all the menopausal symptoms, you have to take it already. So whether it's in a gel, whether it's a tablet, you have to start. Or I have patients who have used they're still on Climara patch, which they buy online. No, so how long will you be taking it? As long as you need it. There is no standard rule that you stop somewhere in between. Basta you have started. Now, who are the ones who should be starting? Those who are just menopausal for the first 5 years are the most ideal people to start. If you have menopause more than 10 years, hindi na siya advisable to take hormone replacement except the transvaginal. Yung ilalagay mo sa vagina, you put in to lubricate and to also soften up, and that one has no effect on the central body, not much. But the oral, the transdermal, the patch, is once you have started it after you have menopause 5 years or a little over, you have to be checked by a doctor first. I regularly ask patients to come see me every 6 months to 1 year and have a routine checkup, like kumusta yung breast nila, may mass ba? Besides my palpating, they also the effect that yung their blood chemistry. Are their blood chemistry okay? Kasi kung meron silang problem with the liver, they cannot use the oral. They have to use the transdermal gel or patch. So, I will not hide, I am 68. I had menopause surgical at age 44. I'm still on hormone replacement therapy. Okay, so there is no reason for me to see that I need to stop, because every time I stop for a week, I get hot flashes. No, hot flashes is not good because you lose your memory cells. You have hard time remembering, and I cannot afford to be forgetful.
So we have a specific question here. If a 56 years old menopause for 6 years, this is in line with actually what you said. With peripheral artery disease, hypertension, family history of breast cancer with menopause symptoms, can she take hormone replacement therapy?
Your school is coming to drop the books. Yes.
I guess this is not the best place to discuss about this. The doctor, for example, ako, I have to look at you generally. It's not the overall, oh, ganito, meron akong ganito. I have this, I have that, I have that. I have to look at your profile. Even if you're 6 years post-menopause. And then, pag may BTE, that's an absolute contraindication. BTE is venous thromboembolism. So if you had an embolic phenomenon in the past, absolutely hindi pwede. Pero you can use the transvaginal route. For example, you have dyspareunia or you have frequent UTI, wag na natin sabihin sex. You need a vaginal cream, then that's the one that needs it desperately. Kahit na may BTE ka, kahit may hypertension ka, it has no impact. The impact of that cream is thus the lower that part of your vagina or your urethra that will help.
Okay, so of course, I think this is for Dr. Jenny Jose. If you don't mind, is it okay to ask how much does the whole thing cost? Maybe just a ballpark figure. It doesn't have to be the exact.
Right. Actually, there are different machines, right? We have the erbium YAG laser, the CO2 laser. We can also have the radio frequency. It actually depends on what the patient needs. But I think it is best to say that it's good to have a budget of 20 to 30,000 per session for whatever the patient needs, because of course it depends on the indication of the patient and what machine we need to use.
It's just like similar to how much a person would actually spend if they're trying to lose weight, right? So if they're trying to keep their healthy lifestyle, it's part of we have to make sure we have to budget that, right? Yeah. So it's not too expensive and not too it's something that is within reach for others, right, Doctora?
Yes, yes.
Okay, I think another question, what can you advise on women taking thyroid hormone replacement medicines? Maybe for Dr. Jonathan Garcia. Of course, this is kind of vague question, but maybe in relation to menopause, thyroid replacement.
When you say thyroid, it is our switch box in our body. It is a different hormone from estrogen. It is one of the basic hormones that our body needs. So it is not the same as estrogen replacement. So you may have a thyroid problem, you need thyroid replacement, and you have an estrogen problem, you need an estrogen replacement. So you can have these two together. One does not take the role of the other. It's a two different, it works differently. So I hope that answers your question.
Yes, Doctora, thank you. So if you have no menstruation for the past 3 months, but only breakthrough spotting, is this considered menopause?
The definition of menopause is you have stopped menstruating for 1 whole year. So kung 3 months lang, you're not yet menopause. You're just having hormonal imbalances, which cause you to have irregular menstruation. So you have to find out. And then how old are you? Are you in the perimenopausal period? So you may be having fluctuations of your estrogen, but still hindi ka pa menopause kasi when you do an ultrasound, you will be able to see that there are still follicles or eggs in your ovary.
Okay. There's a question here about the hormone replacement therapy to be given for 40, 50, and 60. But as you said a while ago, this should be targeted.
I think I can answer Rosita Pardo. No, when you're 40, you're in the perimenopause. Okay, it's not postmenopause unless you are premature ovarian failure. Okay, so the criteria there is different. It's more of POI or premature ovarian insufficiency. So you have to replace the estrogen as much as possible because there is an impact on the patient. We know that somebody who menopaused earlier are more risk of having heart attack, strokes, of dying earlier due to the cardiovascular disease. Now, for somebody who is age 50, who is naturally menopausal, you can opt for a lower dose of your estrogen. So it does depend on the the age group. And if somebody who's 60 who has menopause already for 10 years, we don't give hormone replacement therapy. It is a standard rule that those patients would not be best to take it because they may have a stroke as a result of their hormone replacement. So definitely there is a different, it's not a criteria, it's their, how long have they since they menopause. Kunyari, the age 60, nag-menopause siya 54. So she's just 6 years. So you assess her individually. Tingnan mo muna cardiovascular kasi usually pag ganitong edad, they have already heart disease. Usually may hypertension na yan, may diabetes. So assess each one individually. Hindi pwedeng as a whole o pag 50 ka, ganito ka, pag 60 ka, ganito. Okay? Yes. I hope that answers Rosita Pardo.
Yes, Doctor. Thank you. So I think for our last question, if women started to menstruate earlier than 9 years old, actually this is a common myth. Like if I menstruate early, does that mean I have menopause early also?
To answer that, I would like to inform the public that is not true. If you late menstruate, you menstruate at 16, you will early menopause. Baligtad, pag early ka nag-menstruate, okay, you will still have a late menopause. Kasi normal ang ovarian function mo. For those who are late, they are abnormal ovarian function.
Okay.
Is that correct, Dr. Joanna, my friend?
Yes, Dr. I think one more question, maybe like they would ask also, like if my mom had her menopause at this age or my sister had her menopause at this age, will I have the same?
We have not done so much study here in St. Luke's. No, we have a profile, but generally, when your mother naturally menopause at 50, you will follow suit at 50 ka rin, unless you had surgery. That's how it is. But so far, the ones that I have interviewed, the ones that I've been seeing, I usually ask them, oh, pakitanong, when did your mother menopause? So it will be 1 or 2 years between that stage. Okay, so I guess it has a genetic factor when you start menstruating and when you start, but it has also an environmental. So if you're a smoker, okay, and you keep on smoking, you may menopause na earlier, much earlier by 3 to 5 years from your mother. Your mother menopause at 49, but you're a smoker, heavy smoker. You may menopause at 43, 40, 42. So that's why as much if I know a patient, I smell that she is smoking, I normally dissuade them not to smoke so that they don't grow old. Okay?
Thank you, Dr. We have last two questions, but maybe that you can answer. So like one patient is asking, she's 43, she stopped menstruating at 40, and still experiencing hot flushes. Will she still benefit from HRT?
Yes, she will benefit from HRT. Pero bakit siya hindi nag-menstruate? So we have to find out.
So it's good to go to her OBGYN so that they will be able to discuss it, right, Dr. Ram?
Yes, ma'am.
One question here, what supplements should we take on onset of perimenopause?
Usually, I recommend vitamin D. Hindi E, hindi E. Vitamin D as in dog. And then, kasi it has many benefits. It helps you not have osteoporosis. It helps you not having cancer. Then the other one is normal multivitamins lang. Okay? Pero separate yung vitamin D.
Okay, to Miss Bianca Medina, maybe she can ask her question. She only gave info. So that maybe Dr. Jose or Dr. Jonathan Garcia can proceed answering any of your questions in the chat box. Thank you so much. This ends our open forum. Thank you so much. So now we, of course, go to our much-awaited virtual games, right? Okay. So in our virtual game, of course, you've all heard about Bring Me, but of course, since we're in a pandemic world, it's going to be slightly different. So when you see an item on the screen, you can go ahead and just go through your cabinet and look for it. Once you see it already, type in your chat box, me. And of course, the first one we see will announce your name, and you have exactly 3 seconds to turn on your video and say something, me, and then say the word of say the name of the, like for example, if it's a handkerchief, and then say your name, okay? So we'll start. Drum roll, please. Okay, so our first item for the day is a fan, pamaypay. Not an electric fan, just a simple fan, pamaypay, handheld fans. So I know it's not summer anymore, but oh, wow, ang bilis, meron na kaagad. Okay. Miss Marichi Uy, can we ask you to turn on your video? Of course, anybody who writes their name and says me allows us to say their name and of course show their video, okay? In line with data privacy laws. So Miss Marichi Uy, wow, I see it. Okay, why? With the pink, very, very cute, pamaypay. Congratulations, ma'am. Okay, please send us an email through productinfo@stlukes.com.ph. Mukhang hawak-hawak talaga ni ma'am, kaya mabilis na me. I was kind of thinking, wow, baka magtagal tayo, pero hindi pala. So now we move on to our next object. This one is very, very easy. Okay, so pause muna tayo sa lahat ng Miss, ha? So our Monica, our tech team will say the next water. Oh, sino na yun? Oh, sino? Sorry. Amelia. Gan.
My patient also.
Wow, ang daming viewers,
Hindi sila lang ang nag-attend eh.
Amelia Gan. Okay, I see it now, Amelia Gan. Water, it's a bottled water. Thank you, congratulations. Congratulations, Amelia Gan. Please send an email to productinfo@stlukes.com.ph with the subject Menopause Lay Forum. Please attach a valid ID. So next item, milk. Milk, any milk, powdered milk, ready to drink milk, any milk. Okay, we have a winner. Ang bibilis, grabe, I'm so impressed. Grabe, competitive level talaga. Miss Neveline Ocampo, congratulations. Miss Neveline Ocampo, you have 3 seconds to show us your item. Neveline, 1. Wow, I see it. It's a non-branded milk. Congratulations. Grabe, I'm so impressed. Ang bibilis ng mga natin. Parang seconds lang, meron na kaagad. Yeah, parang nakasatabi lahat. Para kayong pagkakunwari nag-apply for an online concert, kayo yung mabibilis. Okay, finally, for our last object, it's a sunscreen. Sino daw? Okay, our next winner, Mylene. Mylene with no surname. Ma'am Mylene, okay, please turn on your video and show us your sunscreen. Ma'am Mylene? Oh, ayan. Oo nga, nakapackage pa. Ang ganda naman, ma'am. Talagang handang-handa tayo. Okay, so that ends our raffle prizes. I hope you had fun with our munting game to help us have fun today. So, just to recap, we had two lectures today, one by Dr. Joanne Tan Garcia on what to expect during menopause. Of course, she highlighted the importance of healthy living, proper diet, exercise, stress management like yoga and meditation, and of course, her favorite word, sleep, sleep, and sleep. So it's important to be able to understand the importance of when hormone replacement therapy should be given. So you should coordinate with your OBGYN to be able to understand what is most appropriate for you. There are herbal supplements that can help. She mentioned Bionutrifema for hot flushes. And of course, she also said that hormone replacement therapy can be given within 5 years after menopause, but not beyond 10 years. Our next speaker actually talked about the new modalities, the new gadgets, new toys that can help us deal with menopause. So she emphasized the importance, safety, and efficacy of vaginal laser therapy in the treatment of vulvovaginal dryness, atrophy, and menopausal dyspareunia. HIFM technology in lieu of Kegel's exercise. Of course, we understand that you're all busy. So there's HIFM that will help you do the exercise. We exercise our mind, our body. Of course, we have to exercise our private part as well. So it will really help us with your deal with menopausal problems such as urinary incontinence. And of course, there's labiaplasty for the sagging vulva. We'll never see pomelo in a way that's not going to remind us of Dr. Jenny Jose. Okay, so to end our day, we would like to invite Dr. Yvette. Meron pa pala tayong 2 raffle winners. Okay. So we have more raffle pa pala in menopause trivia. So our next trivia. Okay. So again, we will ask you to say the right answer. So true or false, round 1, menopause automatically starts at the age of 50.
False.
Yes, it's false. Again, the winner is Miss Amelia Gan. Wow, ma'am, I'm so impressed. Parati talaga tayong winner. Okay, so that means you can win more than once. So please do participate again. So next round. Last. Multiple choice. If a woman experiences menopause after age 50, how long should she continue using some form of birth control? A, no need. B, 3 months. C, 6 months. And D, 12 months. Okay, so we had a bit of a conversation here because Miss Amelia Gan is so good, and because we announced that she can win more than once. Our winner is Miss Amelia Gan again, letter D. Ma'am, ikaw na po talaga ang pinakamabilis na magsagot. Okay, congratulations. You won a free transvaginal ultrasound. You may claim your prizes through email, and then we will send it right at your doorstep. Please make sure to email us directly. If anybody contacts you asking for your info, please do not answer. You will be the one to email us just to make sure you will be safe. Congratulations to all the winners. May we ask everybody to mute their microphones? So I think this we have raffle prize Okay. So those who won the raffle prizes and the winners of all our games, you may actually email us. Okay, so we had two wonderful lectures today, one by Dr. Joan Tan Garcia and Dr. Jenny Jose. And finally, to end our day, we'd like to invite Dr. Yvette Manalo Mendoza. Thank you and have a good day.
Hi, good morning. I'm Dr. Yvette Marie Manalo Mendoza. I'm one of the people behind this event. So as we take the leap and evolve in the better normal, we braved a new format for this Menopause Lay Forum and brought it virtually to continue with our aim of bridging patient education. So thank you to all our participants for staying with us despite the initial glitches. It is our sincere hope that you all learned a thing or two from this webinar. So on behalf of the team, we also wish to extend our grateful appreciation for our speakers for sharing their invaluable time and expertise. And of course, our very able moderator for steering a very engaging session this morning. Lastly, I would like to acknowledge the efforts of the people behind the scenes for making this event possible and a success. Tomorrow, as we continue with our OB Week celebration, please invite your daughters, nieces, and apos for the Mom and Baby Lay Forum. The details for the registration are flashed in your feed. A pleasant day to all.
And most respected healthcare institution. We provide services for women of all ages for the proper care of their health needs. This includes ultrasound. St. Luke's Women's Health Center offers gynecologic ultrasound. This helps doctors assess not only the uterus, but also organs inside the pelvis. Cervical cancer screening.